Let's get some reaction to those numbers now. KwaZulu-Natal, one of the provinces with the most COVID-19 infections over the last week or so. The province is recording above 2,000 cases daily. Are there any concerns behind this sharp rise in infections, especially following the festive season? For more, we're joined now by Sandile Tshabalala. He's the KZN Health Head of Department, joining me live from Durban. Thank you so much for your time this evening, Sandile. We're not new to this pandemic. We've kind of seen these waves come and go and able to read the patterns to a certain extent. Well, the scientists can, the experts can, people like yourself can. Before we headed into the festive season, there was already talk that after the peak of the festive season, areas or provinces where vast numbers of tourists and visitors were expected, like KZN and the Western Cape, will probably see a spike in numbers. Is that what we're seeing now?
Good evening, Marcelle, to yourself, and good evening to the viewers of your show. Yes, what we are seeing now is what was predicted. You will remember that the fourth wave was predicted to start between the end of November and the beginning of December, and that is what exactly we came to see. What came to worry us as a province of KwaZulu-Natal is that when we were seeing these figures, we were seeing them increasing very much so before the 16th of December, and that usually is the time when most companies close, and as such, most people start their holidays. Those numbers increased such that it is in this period or in this wave that we saw daily statistics or daily numbers above 5,000, actually towards very close towards 6,000. But we have seen them going down now. We are averaging around 2,060, but we think the issue of vaccination is the one that is worrying us more than the new cases, given the fact that Omicron has been, yes, giving us more numbers in terms of infections, but in terms of symptoms, it's not been that bad.
Now, speaking of infections, a couple of weeks ago, there was talk about how sad it is really that KZN as a province was leading the way in terms of the numbers of people being vaccinated, right up until we saw the civil unrest take place in July. And the province just hasn't been able to get back to those vaccination numbers it had before that. How much of an impact did that have? And why are we now struggling to get those wheels turning on those vaccination numbers in your province again?
Look, as a province, we've now been able to give more than 4,301,000 jabs, but we are sitting at 33.5% in terms of people that have been fully vaccinated. We are worried about that. Now, the impact of different activities may have had their own contribution, including the activity that you're talking about. But there are many other activities. For instance, when we started to vaccinate people between the ages of 12 and 17 and those between 18 and 34, we expect that would give us a very high number of people who come for vaccination. But already the main factor that has made us not to see that has been the fake news that still are abound, such that the advice from our premier, our MEC, and everybody who is leading in the province, who we must thank, by the way, is that we should be able to say, how do we convince people to say the vaccines are a necessary step against the fake news that are taking place. As such, we are looking into new strategies of how do we engage the people. All those strategies will then be applied so that we increase the numbers of vaccination. Our worry is that we are seeing new variants. We are hoping that when we get new variants that are more virulent, we will have more people that have been vaccinated.
Indeed, we can only wish you everything of the best with the new strategy that you have in terms of trying to get past all of the fake news that we're seeing, especially on those dangerous social media platforms as well. Thank you so much for your time. Sandile Tshabalala, KZN Health Department Head, joining us live there from Durban.